My opponent begins his claim by stating that only two of the physician-assisted suicide cases were screened by a psychiatrist, but he had a faulty source. It was actually 8.4% of the entire physician-assisted suicide that were screened. And secondly, he said there's only a small minority of patients that actually do want to go through the physician-assisted suicide. According to a study by the National Institute of Health, only a small minority of terminally ill patients seek physician-assisted suicide. In their study, 988 terminally ill patients and 893 caregivers in 6 randomly selected areas of the United States were selected. Around half supported euthanasia in a hypothetical situation. 10.6% were seriously considering physician-assisted suicide, and only 14 patients of the 988 terminally ill patients asked their physician for more information regarding this information. My opponent was right in saying that degrees cannot judge pain, but according to the Humanist, an article written by Peter Rogatz, MD, he says treatable pain is not the only reason, or even the most common reason, why patients seek to end their lives. Severe body wasting, intractable vomiting, urinary and bowel incontinence, immobility, and total dependence are recognized as more important than pain and the desire for hasten death. There is a growing awareness that loss of dignity and of those attributes that we associate particularly with being human are the factors that most commonly reduce patients to a state of unrelief and miserly desperation. Physical problems, besides pain, physical problems can cause emotional distress and can be an additional burden to the patient. John Close endured the painful deterioration of his body from Lou Graves' disease for 2 years. By the time he died, he could not talk or swallow. He could barely move without assistance. He choked regularly on his own saliva, recalled his sister Leslie. He did not want to get to the stage where he could do nothing for himself, and this was a step beyond a dignified life for him. Imagine experiencing this for 2 years. Also, the opponent cited that a girl pressured a doctor assumed that a girl pressured her mom to being euthanized, but he said there is no evidence proving this, and there's also screening when the mother had to attend the second physician. She also had according to the law, she also had to take additional screening. He also stated that the Hippocratic oath should be applied, but the Hippocratic oath changes over time with the environment and the morality of the time. There is no risk-free solution to these very sensitive problems. However, I believe that the reasonable protections can be put in place that will minimize the risk of abuse, and that the humanitarian benefits of legalizing physician-assisted suicide outweigh the risk. All physicians are bound by the injunction to do no harm, but we must recognize that harm may result not only from the commission of a wrongful act, but also from the omission of an act of mercy. While not every physician will feel comfortable offering help in these tragic situations, many believe it is right to do so, and our society should not criminalize such humanitarian acts. That's all.